I want to welcome his family tonight. Dr. Jan Sue, his father is here. Dr. King Herb is here. And the love of his life, Manada Kane. You know, as we give these presentations, I've talked about this with some of my colleagues, finding the right length is really difficult. This is a momentous occasion. It's probably one of the most important days and nights of a young surgeon's career. So we don't want to make it too short and not do justice to the occasion. But on the other hand, if we get too long, well, that's going to put the old guys like Dr. Orkin asleep. So doing that. Fortunately, Dr. Sue came up with a new AI application that uses machine learning and generative AI to help us figure out how to do that. And that's it right there. So the dots on the fingers, that's a testament to Dr. Sue tattooed his fingers so he can measure things. And dedication to service. So that line, that's the perfect length of a dot.
Yes.
So the other thing that I enjoy about these is this is two worlds colliding for the chief residents. Most of them, I take them around their family and shape them and mold them into what they are today. And then we put them in this crash course of surgeons and residents and students for 5 years. And they're pretty separate until tonight, right? So one of the things that I really enjoyed about these presentations in the past is seeing those things coming together and learning about what they were like when they were younger and how much that matches up with what we see when they get here. All the great work that the families have done to prepare them for this moment and the moments to come. So a couple of examples of things. Dave is well known as a very strong mentor for our residency programs, for our students, for the junior residents. I used to see his comments on his applications and how much the junior residents love working with him, just like most of our other residents. But Dave, really, that was very important to him. And we found out that started when he was very young. So this is a picture of Dave and his brother Jeffrey. He was born. And Dave, from day one, he doted on that young brother of his. He dressed him up, he got him teddy bears, he just wanted to present him to the world. And so he was a great mentor. He did that for a while, and both of Dave's parents were working, and so I'm sure that Dave spent a lot of time helping his little brother grow up, and did a great job of that. Now, unfortunately, though, we had to curtail Dave's mentoring for a while because he found another passion in life, and when he found his father's beer stage. So, and that ultimately led to this. And now this is, seriously, I did a Google search for Dr. Minda Sue. And literally this came up. And so there's a great story behind this. I don't know what it is, but Dave and I have had lots of long talks, and I know a lot about him, but he didn't tell me about this one, so maybe we get some liquor in it and maybe we can figure it out. So Dave's curiosity and conviction is another trait that we saw as he came. He is very curious, very creative. So Dave is a different cat, so when he got Lego toys, these complex Lego toys, and apparently you put them together, there's instructions, you go piece by piece, you create these intimate models of robots or the Millennium Falcon or something like that. Not Dave. Dave would take the pieces out, dump them on the floor, and then just start putting them together. And his parents would say, Dave, why are you doing that? That's not how you're supposed to do this. He said, I don't care, this is what I'm doing. And ultimately, Dave would put things together, and he would create something that's more intricate, more dynamic than what's on the picture box. Dave has always had that creativity and that conviction that he knows what to do in this right way. Now you fast forward to residency in that conviction. Let's just say it took a little getting used to for our attendings. Over here and see his comments. Why is Dave arguing with me, right? And because Dave studied, he was always questioning. He was always looking for a better way to do things, to have the right, asking, do we have the right diagnosis, or what are we missing? And early on, when he was a young resident, he was, coming up with good ideas, but oftentimes he focused on maybe the wrong point to see he was learning. And then as he later on, he got in the middle of his residency, he would bring up good points, but there were usually other options, but they were good points. But the last year or so, Dave, well, it drives me crazy because he's usually right. am. So he would say, Dr. Rowitz, do you think this is PQRS syndrome? And I'd say, I don't know what that is, Dave. What is it? And he'd explain it to me and say, is it PQRS syndrome? And he'd tell me yes or no. So yeah, I learned a lot from Dave over the years. But each time, every one of those ideas was very well thought out and presented with absolute conviction, and I admire him for that. Dedication and devotion to his crafts. Dave is a Renaissance man in many, many ways. It started with art. When Dave was a young man, a young child, he loved to draw. And he would come home from elementary school, and his parents would find out that some of his artwork was being shown at the mall. And they'd say, hey, what's going on? And they would say, it's no big deal. Okay? And he went on, and all through middle school, he would win awards and have presentations. That's Dave with his young brother Jeffrey again. And he won a very prestigious award from his high school, Walt Whitman High School in Maryland, for his artwork over the years. He won the art award. And sort of the culmination of his artwork in high school, this is a picture from a presentation that the class did on different cultures, diversity, and coming together. If you look in that background, that's a massive mural, 10 meters by 8 meters, 30 feet by 24 feet. Guess who painted it? Dave. So his art took him further. I believe, correct me if I'm wrong, he was in medical school years, where he turned to creating anatomic sculptures. These aren't real bones and things here. This one on the upper left side is a picture of a fractured pelvis and vertebra that he modeled, that he saw in the trauma patient, anatomic creations of hands and things. Very, very gifted artist. So they carried that same passion and dedication as academics. Funny story. Dave was majoring in cell biology at the University of Maryland, but he was also majoring in art, not surprisingly. So as the years went on, Dave was able to finish and was prepared to get his degree in cell biology. And he told his parents were happy because he said, okay, no more tuition, it's on to medical school. And Dave said, I want to stay and I want to finish one more year and get the art degree. His parents said, well, if you're going into medicine, you don't really need that. This will help you get to your career. And Dave's answer was, art is in my blood. If I don't do this now, when I'm 99 and about to die, I won't be able to close my eyes. So, I'll his parents with that, so he got it. Now, he doesn't do anything bad. I think everyone who knows him knows that. He was a great student, he was a good student, he got good grades, and his parents are both physicians, and they said, hey, if you want to go to medical school, you should be getting straight A's. You know what Dave's reaction was? Straight A's are for nerds. So Dave goes to medical school, and his mom tells him, hey, you don't need straight A's in medical school. You get great residencies, just pass your classes, get good grades. What does Dave do? He goes and gets nerd grades. At 4.0 in medical school, one of 8 of about 500 students in graduating class to get a 4.0. He doesn't do anything halfway. And now you fast forward to his passion for surgery, and it's really he has calluses all over his hands. When he came in as an intern, because he was practicing laparoscopic skills before he even got to a surgery residency, the tattoos on his hand to measure, those are permanent tattoos, so he could measure the size of the mass for lesion. He had corrective eye surgery because he didn't want to wear glasses in the operating room. He didn't want to have his vision corrected in the operating room. Dave stayed late as an intern. I would see him on the floors, and that's not uncommon. Interns are getting used to the new operations and things, and it takes them a long time to do things and write notes and finish rounds. And so Dave would stay till 10 o'clock. And just like last week, I said, Dave, I remember when you used to study till 10 p.m. getting your notes done. He said, I still think 10 p.m. working. finish residency because he had such a good time last night. Everybody else says. So again, he doesn't do anything halfway. He's going on to do a bariatric fellowship, which is not only one of the most respected fellowships in bariatric surgery, nationally recognized, it's also one of the most intense and rigorous. So a lot of fellows, when they're going, or potential fellows, when they're going out, they're looking to see, are there residents there, right? Because if there's residents there, then that means there's a lot of work that they don't have to do because somebody else does, right? Not they. He went to a program intentionally because they don't have fellows, because he doesn't want to miss anything, right? So again, that passion and dedication for everything he does. I don't have a picture for this one. This is more of a story about Dave's diligence and compassion. And he told me a story several months ago, and I think once earlier in his, but his mother passed along to me as well. But Dave was an intern at the Mayo Clinic. He was doing a prelim area. And he was on the wards, he was staying late, and he was thinking it was time to go home, but he decided there was a patient in the hospital with abdominal pain. He said, something's not right, I'm going to go check this patient before I leave and before I go home. So he went to see the patient, and she looked really ill. She was tachycardic, her heart was racing, she was having worsening abdominal pain, and Dave said, something's not right here. Now, he's an intern at the Mayo Clinic. There's a hierarchy that you're supposed to go through, and but he saw this patient was in trouble. He walked outside, and fortunately, the attending surgeon was there, and they rushed this patient to the operating room because they had a problem with pregnancy where the uterine vessels go through the wall, and so very high risk of emergent bleeding. People die from this very, very, very frequently. So Dave recognized this. He and the attending rushed the patient to the operating room. Dave is an intern, his first assisting, which he's through the moon on this, because of course worried about the patient. Interns don't get a chance to do that kind of stuff. And so the rest of the team came slowly, and Dave stepped down the line into the position of the usual intern. So they get the patient through. She's critically ill. She's in the ICU. Dave goes home, and Dave can't sleep. He can't sleep because he's thinking about this patient, and he's worried about this patient. He just can't fall asleep because he doesn't know how she's doing. So he comes in the next morning, and he's wondering if she's alive and the baby's gone. He walks in the room, and the mother's awake, holding the baby, and Dave cried. He doesn't do anything after. I think to summarize, Dave's mother was really helpful, sending pictures and stories, and we talked on the phone, we had a great time. And she actually prepared some narrative that I'm summarizing a lot of this. And I think these comments really sum it up. Dave's journey has been anything but ordinary. He has blended science and soul, art and action, intellect and intuition. We've watched him grow from a curious child to a compassionate healer, someone who not only has the hands of a surgeon, but also the heart of an artist. And now, as he graduates from residency, we are so proud, not only of what he's accomplished, but who he has always been. So to close, interesting story. How's that expression go? I can't say it. It was today I was born, or whatever you say. Though I just learned, for 5 years I didn't know Dave. Is it Bingham? Is it Dave? I would ask Dave, or Bingham, or whoever. I would say, what do you prefer? I don't care, just whatever you want. I said, no, you really, what do you prefer? I don't know. You just call me what you want. What does your family call me? What do your friends call me? Call me what? Call me Bingham, call me Dave. So when I was on the phone with his mom, I said, I'm going to find out, right? And I'm trying to get her to mention, I'm not trying to get her. She's really telling wonderful stories. And so I hear her say his name, and you know what she says? David. So I didn't know. I was still confused. But in the email she sent me, his name is Dave. They call him Dave. And so I will call you David moving forward. So since you are now part of our Carl family, we thank you and all your colleagues, all your graduating colleagues, for all the wonderful things you've done for our patients, for our hospital system, the things you've taught me, the things you've taught the students and the other residents. You'll be sorely missed, and we're all kind of sad when you go. But what drives us, what keeps us going, is we know all
Dr. Yu, Dr. Yu, Dr. Yu.
Everybody.
Thank you so much.
Jeez. Standing up here today still doesn't really feel real. I guess I started this journey 16 years ago, 6 years of residency. When I was here first, the first time I interviewed here at Carl, I really felt there was something special about this place. Every single core faculty member came out to the interview. And while other applicants thought that that was stressful and potentially bullying, and I thought it was amazing that every single core faculty member was this invested in our training and education and wanted to get to know the next generation of residents. Carl was kind enough to let me have a short intermission somewhere else before finally coming here to get my bits in. I've always been very appreciative of that. I want to thank Dr. Kim and the entire match committee for ranking me high enough that I got the chance to match here to be a categorical resident. Thank you to all the nursing staff who showed me how to do things better. The attendings who taught me how to be better. My juniors who humbled me when I thought that I was above average. Thank you to my attendings who let me operate on your patients and for a brief moment in time, let them be our patients. Thank you to my patients who trusted me to cut and care for you in your times of need. Thank you to Dr. Rowitz for entertaining me and frequently going over schedule with all of our semi-annual meetings. I don't think I ever finished earlier. Thank you for my parents for supporting me and my frivolously expensive endeavors through the years. I don't think I will ever use my bachelor's of arts that I demanded to get. Thank you to Manada for being with me.
Yeah.
For keeping a clean home, making warm meals for us to share when I came home late from work, and listen to me rant when I had a long day. And lastly, thank you to my co-chiefs for this entire formative process. Starting and finishing this journey with you all has shaped me more than you can know, and I will always remember the time that we have shared together. I could not have done this without all of you.
Yay! We need to find out what's in there.
So